And there's always an opportunity to listen to, to customers who are engaging with your product, and then taking that feedback back to the team to do something about it, and then iterating on that problem.
I love that. It's almost here are the guiding principles for why you chose us and what you're looking for. Let's maintain this pulse where this is what we're driving for. These are the metrics we're seeking to hit. So first, what I'll say is, hey, everyone, and thanks for joining us today. My name's Sarah Baccia, and I'm a director of sales here at Redox. I lead the team at Redox that focuses on our remote care technology partners and patient engagement solutions. And I am tuning in here from Madison, Wisconsin, where we're actually seeing some nice weather for late September. So I'm going to take that as a win. And I'm here with Jennifer Johns, who is VP of Strategic Accounts at Propeller. So to give a little bit of foundation around what we're going to cover today, she and I are going to have a conversation that is going to be geared both for providers who are looking to understand how to empower patients in their care, as well as product partners who want to learn about the journey that Propeller has gone through from really early stage startup to their dominance as a leader in the COPD and asthma management space. So I personally am really excited to hear about Propeller's platform from Jen, and really to hear about some of the specifics about their journey and the achievements that you've all had. So for everyone who's tuned in, feel free to plug in any questions that you might have in the chat. What we're going to do is we'll make sure that we save some time at the end to talk through those questions, the ones that have been voted the highest. You may also notice that there is a little banner at the bottom of your screen. It says Propeller Health's website. You can click there if you want to learn a little bit more about them, what they do, to get more information. So I guess to get things rolling, I would love to hear from folks who are tuning in. Where are you from? Where you hail from? Where are you calling in from? What kind of work do you do? And maybe what is your role at the organization that you are from? So then without further ado, Jen, I'm going to put you on the spotlight. As I said, I'm excited to learn a little bit more about you. Do you mind giving everybody a sense for your background, how long you've been at Propeller, and what brought you there?
Sure. And so, Sarah, thanks for inviting Propeller and me today. I really appreciate it. I love talking about my company and the work that we're doing. So I'm really excited to be here. I joined Propeller probably about a year and a half now. I'm over strategic accounts for Propeller. I manage teams that work directly with our customers, our health system customers, our payer customers, PBM customers. And then I also manage a team that works on the implementation of Propeller into these customer segments. Prior to Propeller, I was with ResMed for about 10 years. ResMed acquired Propeller just under 2 years ago. And I was in their market access, a market access role, health economics role with ResMed. But I've been in healthcare my entire career, just working in different either provider segments or for manufacturers, really working to try and figure out how to drive value in a healthcare environment. So I cut my teeth in lab, working for an anatomic pathology company and molecular genetics company. Moved into providers, representing providers and clinics with payers, and then DME space, and then ultimately landed with ResMed. So happy to be here. Thanks.
Yeah, cool. That's awesome from a lab perspective. So for me, I actually started with an EHR company, and I, kind of cut my teeth learning about the ED space, acute care, all the problems that are facing there. I from then moved to Pop Health because from my perspective, it was like, this is how we keep patients from getting to the ED. Focusing on population health, public health, and those outcomes. So with the work that Propeller does, that was what initially kind of drew me to your story, and I'm excited to hear more about that too. Can you tell me a little bit more then about Propeller and Propeller's founding story?
Sure. So Propeller was founded, if you will, about 10 years ago. One of our founders, David Van Sickle, is an epidemiologist, a respiratory epidemiologist, who was kind of tasked with figuring out the cause of asthma outbreak, if you will, in Barcelona, and was really surprised at how long it took to figure out that the cause of all of these exacerbations, hospitalizations, and even death was attributed to the offloading of soybeans down at the harbor. And he started to ask the question, if we could, what would be a leading indicator, right, to understand, when these outbreaks are going to happen. And he hypothesized that, understanding people's medication usage might help predict when there would be a public health type crisis. And so he partnered with Greg Tracy, who started to put together the actual sensors and the solution through the patient app experience to see if they could map out where patients were using their medication and drive insights from that.
That's really interesting. I mean, it's kind of like how all great technologies are formed, where there's a problem and it's like, we don't really know how to solve it, but can we look to data to try to give us some sense for trends, and from there, develop a problem or a product around that problem.
Yeah, and I think there was a core interest too in public health, right? And trying to not just solve for each patient, but solve for a population as a founding source.
Yeah, absolutely. Well, I think I mentioned this to you the other day, but I have asthma, and so being able to see from a platform how I'm doing, how I'm tracking, I mean, that's kind of the next level. It's moving from population health to the individual patient experience. And I know we're going to spend some time talking about that, but I mean, that idea is just exciting to me. And it's kind of like, here's how we enable patients with the solution, not totally the solution to their problem, but a way to, address it and manage it better. So yeah, I would love to spend some time learning a little bit more about Propeller. I know that you have a deck, and I can pull that up and share it. But for those that are tuning in, I'd love to give everyone a chance to, see Propeller. I'm going to try to pull this deck up onto my home screen here to project. So give me 1 second. But I would love to get a chance for you to kind of walk through Propeller and what it looks like here. So just one.
And I've done this enough times, Sarah, that I can do this without slides.
It's funny, the tech difficulties. They befall us all, I guess.
There you go.
So everyone should be able to see my screen here.
Awesome. So yeah, our mission right there, right? To make life better for every person and community affected by chronic respiratory disease. And I think, we talked about asthma as kind of, foundational to Propeller. But we believe we have a responsibility to all patients with chronic respiratory disease. We have expanded the offer into COPD, and we're looking at how we can be the most impactful with other respiratory chronic disease as well. We have 10 FDA clearances now in terms of the sensors that we manufacture. But more importantly is the outcomes data that we're generating to make sure that these connected sensors are actually driving better outcomes. With over 100,000 patients enrolled now, and really closer to 30 peer-reviewed publications, it's a foundational to our success is to pulling this all together. Go to the next slide. So for those of you not familiar with Propeller, we're a connected health platform for patients with asthma and COPD. We take data from medications, we combine it with air quality data and patient-reported outcomes into the smartphone. All that data is sent up to the cloud, and then is sent back to the patient in the form of insights through a smartphone or back to a provider through a clinical dashboard. Next slide. So patients who have asthma or COPD are typically prescribed at least 2 medications. So there's a controller medication that the patient takes on a schedule, on a routine. So usually daily, usually twice a day. And then there's a rescue medication where a patient uses the medication when they're not feeling well. So when they're having an exacerbation or they're having severe symptoms. And so what Propeller does is combine utilization for both of these types of medications to understand exactly what's going on with that patient. So from a controller medication perspective, we can improve outcomes if patients aren't utilizing their medication. And so we are actually understanding when patients take their medication. And then if they're not taking their medication, we are reminding them to do so. We do this in a couple of different ways. The sensors will chime, so their medication will actually chime to remind them to take their medication, and they'll get push notifications onto their smartphone or through the app to remind them.
Next slide.
Please. You can't read my mind? So on the rescue inhaler use, as I mentioned, a patient will use their rescue inhaler when they're not feeling good. And so we want to understand when that is, right? We want to not just understand it, but start to be able to predict when a patient is going to need their rescue medication. So we take that utilization, when they're using it, where they're using it, what time they're using it. We're combining that with the air quality data, as I mentioned. And then we'll also ask the patient if they are using their rescue medication, do they have any known triggers? Is there anything that they're aware of that could be causing these symptoms? And as a result, we start to build a personalized profile of what's happening with that individual's utilization of rescue medication, because we do want to get to a point where we can start to predict when that patient will have a problem and then start to prevent a problem in the first place. Next slide.
I was on there.
Yeah, we're getting into a groove now. So, that's kind of the patient experience, through the app. But there's also a clinician experience. And so Propeller can, be a standalone solution for a patient who's trying to manage their asthma or COPD, or frankly, for a caregiver who's trying to manage their child's asthma or their parents' COPD. But there's also a ton of insight that can go back to the physician, the clinician, the care manager, to basically illustrate exactly what is happening with that patient. When a patient walks into the office and a doctor asks, how are you doing? Are you taking your medication? They tend to report what's happened in the last 7 days. But this objective data really points to, are they taking their controller medication as prescribed? When are they taking their rescue medication? And it starts to help the physician build, or the clinician, care manager, build a picture of what's happening with this patient. It really allows for a great discussion between clinician and patient. It allows for better insight into the type of medication that the patient's on or maybe should be on, maybe be stepped up or stepped down to a different medication, and just allows for better control. Next slide. And then all of, super important today is that all of Propeller's data can be integrated into an EMR system. Because if we're not where the clinician lives, if the data is not where a clinician lives, it makes it much more difficult for the clinician to engage with the data, which makes it more difficult to have those informed discussions. Next slide. And then I talked a little bit about this in the beginning. We're super proud of the outcomes and the work that we do to generate outcomes, frankly, with some of our partners. But patients on Propeller can expect a 79% reduction in rescue medication use. Patients on Propeller can also expect an increase in adherence to their controller medication. And then we also have demonstrated a reduction in healthcare utilization for both ED visits and hospitalization. So this is kind of the holy grail of where we want to get to from a population health outcomes perspective in both asthma and COPD. Next slide. Yeah, and so that's it.
Well, thank you for that. That was great. And I think, the thing that struck me, there are two things in particular. One, I love the idea that there are conversations that are started when data is exchanged between patient and provider. I would love it if my doctor were to message me and say, hey, it's been a couple days and you haven't used your inhaler. Like, what's going on with you? I'm sorry, doc. Maybe the answer is, I just forgot. Maybe the answer is, actually, I've been feeling really down. Like, with the pandemic, it's hard for me to want to take my medications regularly. The other thing was, just from a user standpoint, having a little ding on my smartphone or on my inhaler really helped me from not losing it. So
it goes a long way, right? I mean, I think some of the features that we built into the app, which is kind of find my inhaler, you can't take your medication if you can't find it.
Right.
And then also allowing patients to kind of refill their medications right through the app through, integrations with pharmacies. Because again, you can't take your medicine if you've run out. So we're trying to, through, extensive user testing, kind of understand the needs of the patient in managing their disease, not just in trying to drive to an outcome, but really trying to make life better.
Mm-hmm. What was also really interesting too is just the consideration of other environmental factors. So air quality just struck me in particular now, and I didn't mention you're calling in from the West Coast, so that's particularly prescient for you. But obviously for a patient with COPD or asthma, that makes sense that's pretty critical for them. But that's pretty neat to look at all of the outside components, not just utilization. It's a broader picture for sure.
Yeah, and I think that lends to the insight, right? Because we want our users to understand understand their triggers, because you can't prevent it unless you have that level of understanding. So it's important data to include in the whole profile or the whole picture of that patient.
Mm-hmm. Yeah, definitely. Well, I was planning on asking this later, but since we're on the topic, I'll bring it up now. What other roles would you say data plays in this conversation? So for Propeller, for the patient experience, for the provider, how else are you thinking about data?
I mean, so data's a big word today, right? And data for data's sake, I mean, everybody's generating data today, right? The challenge is, where is it useful, and where is the value in the data? So for us, we think about the utilization of the data in a number of ways. From a patient experience perspective, we want to provide insights that are meaningful. We want to make sure that the experience is personalized to that patient. And the best way to do that is to gather as much information as we can about how they're using their medication, about the symptoms and triggers that they're entering into the app, about the air quality, about outcomes data, patient-reported outcomes data that we collect through the application. All of that is combined to generate insights. Feeding that data back to the patient is really not helpful if the patient or the user, can't use it. And so we combine that to generate helpful insights that the user can then incorporate into behavior change, into understanding their disease process better, or as a caregiver, their child or parent. or spouse or family member disease process better. Super important. On the provider side, we think about it differently. I mean, similarly in the way that it's insight-driven, but we want to enable that better conversation between clinician and patient. We understand the limitations in time that a physician has or a clinician might have with their patient, and we want to be able to let clinicians essentially manage by exception and understand like what patients need my attention immediately because there's an immediate issue to address.
Yeah, you kind of touched on this at the beginning when you talked about Propeller's story and how you came about a problem. Right now, we're talking about an individualized approach to patients and providers. We're talking about, how you think about those channels a little bit differently because you serve both sides. When you were getting to the go-to-market strategy that you're at now, can you talk a little bit about how that evolved, who you served to start? Has that changed? How has the market pushed you?
Yeah, sure. So,
question.
I take that a lot of ways, different places. So I think, we're founded as the original name of Propeller was Asthmapolis. Doesn't roll off the tongue very easily, but it basically essentially designed to map out where is asthma, to be able to understand where, there could potentially be a public health issue. I think what happened was that there was an understanding that not only, understanding when a patient takes their medication could help inform that problem, but that patients aren't taking their medication as prescribed. And so, I think the average adherence rate to a medication is about 50%. For respiratory patients, it's actually below the average. And so there's a real opportunity to help patients and this population get control over their asthma, over their COPD. And we have to start with adherence to the medication that's been prescribed. And then what happens is if the patient's still not controlled, then there's this ability to look at other medications or other treatment decisions or options. And obviously we started out in the asthma space. We've expanded into COPD, which has been super interesting for us because a lot of our partners deal with this population. The COPD population is a tough one as well from a management perspective, from a cost perspective. And so that's been interesting for us as well. Am I answering your question?
Yeah, absolutely. And I think, I'm seeing a couple questions about, how Propeller plans to expand. I think the thing that it answers for me is, there's been a need for patients to see their own data. There's an issue with medication adherence. Patients generally don't adhere. How do you solve that, but also do it in a way that's practical and having kind of a cohesive experience between the provider side and the patient side seems to be kind of how you've gotten to that answer. And I think
that's fair.
Okay.
Yeah,
I got it. I'm really listening. That to me is fascinating. It's the combination of public health outcome that you're looking to drive, and then from there expanding to real life application for both the person that's impacted, me, and then also the provider who needs to see, okay, who are my outliers, but also how do I know what else is going on in the world that might impact my patient that I care about, but I don't have the time to see the whole panel of patients,
right,
at an individual level. So it's personalized care as well as this sort of broad view, which I think is pretty critical to have.
Yeah, and I think at the population health level or the care management level, or even at the independent physician level, to understand, where to deploy resources today, is tricky when everybody's asked to kind of do more with less. And so being able to point to a population of patients that are at risk, helps deploy those resources in a way that's going to be meaningful and be able to drive the best outcomes.
Yeah, totally. And I know, so this kind of lights up another bulb in my brain, which is we're both quality metrics geeks to an extent. I'd love to talk a little bit about how, regulation has impacted the value that you drive and how that's either influenced your roadmap or specifically, been an area that you've focused on at Propeller. Has that impacted your roadmap sales?
Yeah, I mean, I think it speaks to the value, right? Like when we look at outcomes and we say, okay, patients are going to be more adherent to their controller medication. They're going to use less of their rescue medication, and we're going to see a reduction in utilization around acute care visits or ED visits and hospitalization. We've worked with some great partners to kind of generate that evidence. And that evidence speaks to a value-based arrangement, if you will. So as do quality metrics, right? And so when we look at HEDIS, when we look at MIPS and other metrics that are in place to drive clinical decisions, we feed into that actually quite nicely because of the work that we've done with various partners from an outcomes perspective.
Yeah. Is that something that you usually lead with when you're, working with health systems and selling to them? Like, how does
what? It's a good question. It's usually like an added, and it depends who we're talking to, right? Because if you're talking to the head of quality, then absolutely,
right.
That's the lead story. But a lot of times it ends up being an added bonus because we're talking about, better asthma control. We're talking about better COPD control. The spend for asthma is predicted to be over, $300 billion in the next 20 years. That's in the US. That's a huge nut to crack. And when we're talking about a better controlled patient, we're talking about potentially, less utilization and lower costs. Right. And that's in a value-based world where everybody's trying to figure out how to keep patients healthy and how we pay for true health care instead of sick care. We speak directly to anyone who's kind of grappling with trying to answer that question. And then the quality piece is just a cherry on top usually because those guidelines are already in place.
Yeah, that makes sense. I mean, the way that I think about it is when you have an outcome, the results end up following, and it usually, there is usually a quality metric that you are influencing when you have those outcomes.
Yeah.
When you think about, HEDIS and any other chronic disease management that,
Yeah, absolutely. And I think we're starting to see too, incentive for physicians and clinicians to engage with remote patient monitoring, with, chronic care management for patients who are, who have comorbidities. And so, we always thought value-based would the evolution of value-based would be much quicker than it is, but it's everywhere. I mean, even in a fee-for-service environment, you need to demonstrate value and you need to demonstrate outcomes in order to be successful. And so even if it's not in a value-based or outcomes-based arrangement, if you can't demonstrate value in a value-based model, it's a lot tougher to be able to engage.
Yeah, that makes sense. And, there are two ways that I could kind of take this train of conversation. I think the actual implementation of the solution is something I want to talk about, but I think just thinking about the folks that we have on the line, talking about value during the sales cycle and being able to follow up with that value, do you have any either recommendations or lessons learned, as you've created this solution and now you're selling it and trying to show, the outcomes that you'll have? Any lessons learned for other, vendor partners that are on the line?
I mean, I think I might not be telling anybody they don't know to share that this is a long selling cycle when you're selling into a health system, when you're selling into a payer. It is it's always longer than it should be. It's certainly always longer than you want it to be. The other thing I've learned is that, and my team has learned, that a lot of people can say no, right? And only a handful can say yes. And so it's super important to identify a champion within, a customer segment that can help you navigate those yeses and nos. And then finally, I would say, even though we're learning how to kind of segment our customers better every day, the more we learn about them, I'll also say that when you've seen one from an implementation perspective, you've seen one. And everyone is unique. Everyone has their own outcomes that they're trying to, or goals that they're trying to meet as a part of implementing a program with Propeller. And so, trying to tap into that is critical. And you can't use necessarily the roadmap that you used last time.
Right. Are there any ways that you can get ahead of that? Is that simply just digging more into discovery, identifying the key metrics that they care about?
Yeah, and I can't underestimate, and nor should our audience underestimate the need for an internal champion, because that is insight for us into how an organization works, insight for us as to who the potential blockers are. I mean, you can sell value into a health system or into a payer, but the folks that actually have to implement it have to be okay with the process as well. And so it's mapping all of that out, navigating all of that in advance, providing the proper education and training, reminding about the value to different stakeholders throughout. And it's an iterative, ongoing process. If you think your work is done, you're mistaken, because there's always an opportunity to educate. There's always an opportunity to train. And there's always an opportunity to listen to, to customers who are engaging with your product, and then taking that feedback back to the team to do something about it, and then iterating on that problem.
Mm-hmm. I love that. It's almost here are the guiding principles for why you chose us and what you're looking for. Let's maintain this pulse where this is what we're driving for. These are the metrics we're seeking to hit.
Yeah.
I think it makes a big difference, because without that, you might be at the end and not remember at the beginning, like, what exactly was I looking to get done here? And then you lose all the time.
Yeah. Well, you know what? There's a ton of rabbit holes, and we've been caught down a few of them. And it's important to kind of steer back on track and keep moving forward and recognizing those rabbit holes, because obviously you want to, you do want to help solve. But at the end of the day, you need to move forward.
Yeah, totally. I mean, I think we've all been there, and it's very nice to want to kind of deviate from the originally defined scope, but it can cause a lot of downstream issues.
There's some risks involved for sure. Yeah.
If you don't mind me asking, I would be curious to know if there are static metrics or static goals that you always track when you're thinking about implementation success.
Yeah.
If that question makes sense.
It does. I mean, I think we're spending a lot of time right now on implementation and what that looks like. I think there's such an opportunity to innovate in implementation. And, we want to use evidence-based implementation practices because they obviously have been demonstrated to work. And so we do have, a successful implementation playbook that we play by, frankly, and that we want our partners to kind of subscribe to as well, because we know that that's going to get us to enrolled patients sooner rather than later. So we do look at some implementation benchmark, from a training perspective, from a launch perspective, an enrollment perspective. And then we also look at some clear clinical outcomes that we should expect. Like, we're going to see an increased adherence out of the gate. We're going to, as patients engage with the application, we're going to see a reduction in rescue medication use that outcome has been consistent, it's reliable, and so we look to measure that as well. And then we also look at things like the asthma control test and the CAT score, which is the COPD assessment test, which allows, it's their gold standards for clinicians to gauge like disease status in asthma patients and COPD patients. So we see improvement in both of those as well. And so those are things we point to.
That makes sense. Just going to ask a question about enrollment, and it's escaping me. But that it's almost like you're saying you want this outcome. We have a prescribed best practice that we follow. Is that it's like a mini contract between you and the health system saying, if you want to achieve this outcome, we know that this is what drives it. Versus you might want to enroll patients or take on this other workflow, and we've seen that be less successful. So take me as a credible source here. I know how to help you.
Yeah, we've launched over 70 commercial programs right now, and we haven't done them all right, but we've learned a ton. We learn a ton with every single implementation that we do, and as a result, we can speak with some level of authority around what we've seen and what best practices are with other partners that we've had. And that's important because, the implementation piece is critical to getting to the outcomes, right? You can sell the value, you can get patients involved and engaged, but if the workflow doesn't work, then you don't get to the end game. So we are putting a ton of resources into this right now. And I'm proud of the work that's happening.
Yeah. As kind of a side question, I have to imagine that a part of that process is provider engagement and making sure that they kind of fully understand the platform and training. I've seen that be a barrier in the past. There's oftentimes a patient barrier. Maybe they don't want to use a certain product, but on the provider side, it's how do I make sure that my patients know that they should be enrolled in this? I imagine that your health systems kind of have to take on a little bit of, not effort, but some sort of training and engagement activities to get them bought in.
Yeah, there's a variety of ways that, a patient can learn about Propeller. We get the best outcomes when they learn about Propeller from the clinician. But that said, there are other methods as well. We have some payer partners and others that, do a direct mail campaign or, are emailing patients to, make them aware of, Propeller, especially now with COVID, where patients may not be coming into the office. We all are trying to, get more creative on what that patient outreach looks like. We also have a pretty strong clinical marketing team. And DTP marketing team that can reach patients on behalf of our partners if they feel like they might need some assistance there. So without a doubt, we want to get to the patient where they are, like how they want to receive information. And so we think like a multi-channel process in educating and enrolling patients is the best.
Yeah. It's interesting. That's exactly where my head was at. I've been wanting to ask about COVID's impact to, your customer base, as a company and what that's been. Obviously, everyone is seeing now that the ways that patients experiencing care have to be changed to accommodate for the environment. What has that been like for y'all?
To say that this is a crisis is an understatement, right? And not just a medical crisis, but an economic crisis as well. Not just for, Main Street businesses, but for hospitals and health systems too, whose revenue is derived from, patients walking in the door. And right now, the only patients walking in the door are COVID patients. So there's an opportunity in a way to serve that population. But then there's a lot of angst around making sure that this population who, who's hovering in the chronic phase isn't getting the care that they may need, or the monitoring that they may need. So selling in that environment is not easy. But, we are a digital health company in the respiratory space that enables remote patient monitoring of a population that is high risk for COVID. And so while getting partners to prioritize this engagement is always going to be a challenge during a public health crisis and economic crisis, that we're in a good place to be able to help them not just identify who's going to be at risk of coming into the hospital, but preemptively reaching out and getting them into the doctor's office while they're out avoiding any care, maybe scared. So from that perspective, we've had some good conversations. I can also add that we went back and looked at our data to understand what medication utilization looked like during this crisis. And we've seen a 14.5% relative increase in adherence to controller medication, which to us is an indication that, patients are concerned too, right? They recognize their diagnosis, they recognize the risk that they are in, and they are motivated to, better control their HAS-CVD, especially now.
Yeah, that last point is really fascinating. I would have never thought about that, but it makes sense psychologically. I know that there is a risk out there, and I need to protect myself as best as I can to avoid it. The other part that just is really hits home is, in this time, we need to be able to predict when there is going to be a negative outcome versus having that exacerbation of the disease happen and an ER visit take place where, in-person care doesn't make, it's not ideal, to say the least.
Sure.
It's kind of funny. You've answered a lot of things in a way that segued perfectly into the next question that I want to ask, and this one too. We're at our time, really, as far as our conversation goes, but I'd love to end on, a story. If you've got a, success story from a provider or a patient, or that last stat was kind of,
it's telling, right?
Yeah. But if there are any other good ones, I'd love to hear.
I think, we have a team that kind of collects feedback. And I think what drives us as a company the most is the feedback from our patients. We hear these incredible stories of, there was a child who was, having awful exacerbations and, multiple puffs on their rescue medication on, a Wednesday. Mm-hmm. And the app started to say, hey, what's happening? And the conversation with the physician was, hey, what's happening? Why is this kind of once a week? Is this such a problem? Which allowed the family to kind of look around and say, what is happening on Wednesday? And they couldn't point to anything for the longest time, and then realized that a restaurant down the road was smoking meat on Wednesday. And the air quality or the air was changing, and the child was having a severe response to that. And so it's, did the app say, hey, mom, it's smoked meat? No. But the app gave insights into getting them to think about their situation and enabling a better conversation with the doctor to be able to uncover, hey, we need to keep the windows closed. And, and suddenly life gets better, and the patient's better managed, and better outcomes and lower costs. And, so much happens just from, that small, what would appear to be inconsequential action of smoking meat on Wednesdays, and yet it has huge implications to this family. And so there are thousands of those stories. We collect them, we live by them, and they drive us every day.
That's amazing. I love that story. I think the thing that for me is just so perfect about it is I see when I think about digital health and we think about the role that it plays in modern society. I think there's some worry and skepticism about how are we going to eliminate the human interaction between providers and patients. And it's not telling you exactly what's going on in your life, but it's enabling a conversation so that you can be more, introspective about your health, a little bit more focused. And then providers can have at least a view into something's going wrong, or maybe let's start a conversation. And I kind of think in an ideal world, we're enabling more communication, a better relationship when technology works well and uses data, to your advantage. So that's really cool.
It's a combination, right, of enabling better patient self-management. And as a result, that patient's going to be better managed. They're self-managing. But for those that won't, we're creating a dialogue to allow them to get extra help.
Yeah.
So, we can drive the outcome directly with the patient. We enhance the outcome by enabling that.
Cool. Awesome. Well, we are at time. I know we've got a couple questions, so I will pull some of these up. We've got about 10 minutes. So we've got the first one here. Are you including the ability to monitor spirometry in coordination with medication use?
Yeah, so it's a great question. We do have connected spirometry as part of the platform. It's not commercially available yet, but we have a team that's looking at not just spirometry, but what other connected devices can help patients self-manage and can help inform conversation, what helps clinicians manage from and what information do they need to be able to make decisions. And then finally, what would the patient utilize, right? Because, if a physician says, I want X, and the patient says, I'm never going to use X, right? We need to figure out what that scenario is. And then finally, I'll add, we need to understand what signals feed an exacerbation prediction model so that we can make sure that, we're informing to the best we can so that we can not just predict, but ultimately be in a position to be able to prevent exacerbation.
Yeah, thank you. The next question we had is our Propeller or any plan to expand the reach of the solution outside of the US?
Great question. Yes. And so we've recently launched in Europe and Japan with a pharmaceutical manufacturer and, are getting a lot of interest from care management organizations, hospitals, physicians, clinicians on, how they can utilize the Propeller platform. Early days, but we have a team assembled who's going to be able to drive value outside the U.S., North America.
Awesome. That's really exciting. One final question. Are Propeller inhalers typically covered by insurance at no additional cost compared to regular inhalers?
Yeah, it's a good question. So an inhaler is the inhaler, right? And so that is separate from Propeller. Propeller actually manufactures sensors that attach to inhalers. So inhalers come in all different form factors, all different types. Inhalers, for the most part are covered on patients' formulary, et cetera. The sensors are separate, and we work directly with payers, direct contract with payers, or direct contract with health systems in order to, make the sensors.
That makes sense. And I'm sure that's part of the conversation with them. To what extent do you cover full, transmission or not transmission, but coverage of patients that need this device and, as part of the sale and kind of the
and what is that? Yeah, exactly. And what does that look like? We're compatible with over 90% of inhalers on the market today. We're working with our partners to, make sure that we're able to have compatible sensors available, and we're driving those conversations at the payer level as well.
Yeah, that makes sense. Well, I'm looking here, and it doesn't look like we have any other questions. Thanks so much for your time and telling us about, the path that Propeller's been on, the patients and, consumers that you serve. I've learned a lot and really appreciated it.
Well, thank you for making time go fast. It's always a little bit nerve-wracking, but I thoroughly enjoyed the conversation, and
I did as well. Perfect.